Welcome back to the latest episode of the YouTube channel. So in this episode, I'm going to talk to you about blood flow restriction training. So hopefully by the end of this, you'll understand what it is, how it might be able to help you so that you can easily go away and try and apply it yourself in your own recovery. So what is blood flow restriction training? So it's essentially what it says on the tin. It's restriction of blood flow or occlusion of a particular muscle group or limb, which can be beneficial in the early stages post injury or surgery. So in this case, post ACL surgery. Um, in the early stages post ACL surgery, obviously you're not going to be able to go into the gym and lift heavy weights because there's going to be a lot of pain and it's just really raw post surgery. But the problem is you lose a lot of muscle post surgery quite quickly, and we need to rebuild that muscle as soon as possible. The sooner we build the muscle back, the quicker and easier your rehab will be. If we let it deteriorate, then that can prolong the recovery and make things 10 times harder. So essentially, you're trying to stimulate that muscle building process at much lower training load. So if we want to build a muscle in a normal environment, in a non-injured person, we need to go to the gym and lift a relatively heavy weight, and that can help stimulate muscle growth. Like I said, we can't hit those intensities and those numbers quite early post-surgery. It can normally take a bit of time. So essentially, by restricting the blood flow, it creates the same metabolic environment to that of heavy strength training without having to lift the heavy weights. And then if we create that same kind of metabolic environment, it improves the cross-sectional area of a muscle, so a bigger muscle, which has the potential to be stronger. Now, the focus on blood flow restriction training is it literally builds a bigger muscle. It doesn't train the nervous system to access and recruit that muscle to produce higher forces. So that is still something that needs to be trained in recovery. But if we can rebuild that muscle early, when you progress through your recovery and you've got a bigger muscle, you can get into heavier strength training quicker. And obviously, you get the benefits of that heavy strength training. So if you're not too familiar with how you build strength, there's two ways you can build it. You can build a big muscle, but then you then have to lift heavy weights in order to help your nervous system access that muscle during particular exercise and activities. That is where you become more athletic. So the good news about blood flow restriction training, it doesn't have to be complicated or expensive, and we can trade the precision of it with accessibility. So I'll explain a really low entry point to doing this, which I use myself and got pretty incredible results. Because if you do any reading around blood flow restriction training, it getting a proper cuff is quite expensive. So we've got to remember this is an assistive tool. If all you do is just do blood flow restriction training, you don't consider the bigger picture of recovery and training, then you might fall short of the benefits. So the evidence around blood flow restriction training is mixed, but it's promising. And I think it's one of those where, unless you've got certain precautions or contraindications to using it, which I'll talk through, it's not going to do any harm. So you might as well use it and risk getting the benefit of it. That's my sort of mentality towards it. So this is an example of me. So this was after my stage 1 ACL surgery. So I hadn't had the reconstruction yet. I had a bone graft November 2024, and I had quite a swollen knee after the surgery, and I lost quite a bit of muscle quite quickly, so 3 centimeters. So I was going to get one of the proper cuffs, but I didn't have a budget for it at the time, so I just bought some really cheap bands on Amazon and thought I'll piss around, just kind of giving it a go and see what the outcome is. So I applied the protocol, and in 6 weeks grew my quads by 6 centimeters. So you can see on the picture, so the one with the plaster on is my right knee. The other one is my left. Also, my left one is a lot bigger than my right. I mean, you can still see the definition. It's relatively toned anyway, but yeah, there's a clear difference. And then if you look at the other picture, you can't really see that difference. It's a lot fuller, and you can clearly see the growth, and the symmetry is much more similar. So I did this twice. So I did it in the stage 1 surgery and then my actual ACL reconstruction. Obviously, the ACL reconstruction is a bit more traumatic. I think it was 2.5, 3 centimeters that grew my quads in a 6 week period. still. So I still got some great benefit. I decided not to buy an expensive cuff because of the benefit. I got some really cheap bands. So general rules, I'll just show you this video first. You can see me setting up the band here. So it goes as high up the groin as possible. So you can see it's a lot of people end up putting it mid-thigh, so you're not occluding or restricting the blood flow to the upper thigh. And you can see I've done that quite tight. And you should be able to feel in your quads the difference in sort of pressure. So my right quad with that band on there felt a bit firmer because obviously the blood's kind of pulling and the pressure's increased. So that should that's what you need to kind of feel with that. So I'll just show you that again. So pull it up. You can see I'm doing it quite tight. I pull it down as far as I can, and then pull it up again, stretch it, and I do that a few times to get it pretty tight. So a kind of 7, 8 out of 10 tightness. And then you literally train with that around your thigh. So the main thing is when you're training, you're focusing on a muscle pump and a muscle burn. So just keep it simple. As long as you're feeling a burn in the targeted muscle, the quads or the hamstrings, that's what we're looking for. And essentially, you can use it on any exercise. Now, in early ACL recovery, I tend to program leg press, leg extension, hamstring curls. That's fairly standardized for most people because I think the great exercise is for helping you isolate and load up these particular muscle groups without having to worry about technique on squats, split squats, etc. And you can really get that focus on the muscle burn without compensating. You can use it cycling. I actually didn't do that. But you can pop it on as part of a warm up, 15, 20 minutes max, and just get that pump in the muscle. So you want to feel the quad working. And the protocol essentially is to do 30 reps, 15, 15, 15. Now, in reality, it's not going to be 30, 15, 15, 15. It might look like 33 reps or 27. And then the next set you do might be 17 and then 14 and then 13. I would just focus on feeling the burn in the muscle and going as close to failure as possible. When I did this, it was to the point where I wanted to swear at the end of it and you kind of like gritting your teeth. You don't necessarily need to go that intense. I was comfortable doing that, confident doing it, but we need to understand that we have to train close to failure in order to get the adaptation in muscle growth, muscle size. And then it should be roughly 20 to 40% of your one rep max. You may not know what that is. Again, if you're working close to failure with that rep scheme, you're probably going to be at the right mark. So before my surgery, I think my one rep max was something like 76 kg, which was roughly 97% of my body weight. And then when I started doing this after about week 4, I think I did 20, maybe started at 17 kg actually, which was about 22% of my body weight. And I just increased the weight as I was able to, as I started to get stronger each week. And you're supposed to do it 2, 3 times a week. I was to do it twice. Again, if you're going to failure, twice in theory should be enough. 40 to 80% of limb occlusion, again, that's if you've got the proper cuff, so I won't go into too much detail with that. Perceived tightness, 7, 8 out of 10. That might not be the best way of describing it, but I think it keeps it simple. You should know when you're training because that pressure, that pump in the muscle will, your thigh feels like it's going to expand, not explode, so to speak, but expand. And then reperfuse between exercises. So essentially you do 30 reps, minute rest, 15 reps, minute rest, 15 reps, minute rest, 15-minute rest. And then you would take it off when you move on to your next exercise. So you do leg press, take it off, hamstring curl, take it off, leg extension, take it off. So just some precautions and contraindications. Obviously, avoid getting pins and needles in your leg. Too much pressure on a nerve, blood flow restriction if your leg's going white. Unlikely that you will get to that point in my experience. It'd have to be really, really tight. Contraindications if you've got high blood pressure, heart problems, vascular issues, which most people with ACL reconstructions won't tend to be a healthier, fitter bunch because we're sports players. Although I did have a client who had to have a stent dislocated knee Um, so she had vascular issues, so we couldn't use blood flow restriction on her, unfortunately. So hopefully that was useful. If there's any questions, drop them below. I'll put the link to the blood flow bands that I use, not affiliated with them, just really cheap ones that I'll get off Amazon. If you've got any questions, again, you can always message me on Rick Williams _ACL coach on Instagram. Happy to chat. If you want to help formally applying this into your training because your physio's not taught you through it, or you're just getting the basic sort of rehab exercises, I'm more than happy to see if I can help.